Welcome. Chronic neck pain, particularly in the mid and lower neck, specifically in the neck area, what can you do to almost instantaneously release that muscle contraction, release that muscle spasm, and potentially release that pain immediately? I'm going to show you a very simple technique. Understand, when you look at the neck from the side view, you can see a normal C-shaped lordotic curve. Obviously, with a lot of the work that we do today, as well as the texting, our head is in the opposite direction, looking downwards in a reverse curve called a kyphosis, or a hunching over, which causes that forward head posture and rounded shoulders. Now, most of the stretches that you've seen are general stretches. You take the neck, bring it to the side, bring it forward, turn your head, bring it forward. Those are stretching a bunch of muscles like the levator scapula, the upper trapezius, the scalenus muscles, the sternocleidomastoid or the SCM muscles, and many other general muscles. But this specific stretch is going to stretch just these muscles that we're focusing in on just along the spine. So our objective here is to make a contact in the lower part of the neck, and we're going to squeeze and pinch off that muscle. And as we do that, we're going to bring our head forward like this. And as we do it, you can see the spinous processes fan out like this as we stretch those specific muscles right inside the mid and lower neck area. So what we're going to do, we're going to bring our head back. As we bring our head back, you're going to take your thumb and your next second and third finger, and you're going to squeeze like this. But you're going to squeeze the lower part of the neck, okay, as you go back, and squeeze it hard, and then bring your head forward. And as you squeeze it, you'll get to a point where you'll start to feel that muscle elongate. And drop your chin to your chest and hold it. Okay? So again, we're going to take the first three fingers, a thumb on one side, the second and third finger on the other side. Look up, not all the way up, just look up. Grab the lower neck area, and okay, on both sides of the spine. Okay? So in other words, as you lean back like this, we're going to grab right here. We're going to pinch that area right there on both sides of the spine. And as our head goes forward, we're holding that area so that muscles, all those muscles above, can fan out and stretch. Okay? One more time. You're going to come back, not all the way back, just looking up. Take these fingers, squeeze in the lower part of the neck, squeeze it nice and firm. And then I want you to look down right about here. As you go down towards the end, you're going to feel those muscles really stretch and elongate. That's a great stretch to release that contraction, release that spasm. Those muscles generally go right behind the skull. So as you elongate them, you're going to get a lot of release and hopefully a lot less pain. You can do this technique as often as you like. There's no harm. We're just taking the muscle and we're stretching it to where that muscle is attaching behind the skull. We're elongating it, and we're allowing that muscle to relax to prevent the spasm, the muscle contraction, the muscle tension, which is causing pain and motion restriction. Share this video. Leave your messages below if you like. And most important, make it a great day. I'm Dr. Mandell.